So there's two kinds of fasting. One is this intermittent fasting, the idea of limiting your feeding window. Everybody fasts every day and they break that fast with breakfast. The idea is, or the question is, what's the right amount of time to have that daily fast being? And there's a lot of debate and discussion about that. In our clinic, we recommend a 16-hour period of fasting every day and an 8-hour feeding window. What that basically means is you don't eat 3 to 4 hours before you go to bed at night, and you may delay your breakfast until you've had a chance to do some vigorous exercise in the morning. And that will give you a period of between 12 and 16 hours of fasting every day. Day after day, cumulatively, that's thought to induce changes that may be beneficial. And then occasionally, it may be worthwhile to consider a longer period of sustained water-only fasting. And we recommend that that period of time be dependent on the individual needs of the individual, and that it be done in a controlled setting and under supervision.
Wonderful, wonderful.
So fasting itself is the complete abstinence of all substances except pure water in an environment of complete rest. And we do that for periods of ranging from 5 to 40 days.
Yeah, really fasting is something that everybody should be doing. I mean, that's where the word breakfast comes in, the meal that breaks your fast. Well, you can't break a fast if you're not fasting. So everybody's supposed to be fasting, right? So it's just a question of how long. So if you say don't eat after, dinner at say 7 o'clock and you eat breakfast at like 7 or 8 o'clock, you're talking 12 to 13 hours of fasting is sort of a standard that most people should be doing almost every single day. When you're talking about intermittent fasting for weight loss, most people are talking about going past that 12, 13, 14-hour stage that everybody sort of normally gets. So most people are talking about 16 hours. When you get to there, people start to worry about, are you getting enough nutrition, which is a valid concern. So people who are, children who are growing, pregnancy, breastfeeding, are things they have to be cautious of. If you're taking medication specifically for type 2 diabetes, because they can push your blood sugars low and they're prescribed based on your diet, if you change that diet or if you change your fasting regimen, then you should talk to your doctor about that. But for everybody else, it's just part of the normal human experience. There's actually a huge number of benefits, which is that one, it's a way to sort of lose weight. It gets your blood sugars down. So if you're type 2 diabetic, it can be much better. So those are the two main advantages, and then you get the health benefits of that. So because your body stores energy as sugar, if your sugars are high, like type 2 diabetes, it will come down. If your body also stores energy as body fat, so if you have too much body fat, then it will use it, so it will come down. So then you have all those benefits from sort of losing weight and getting rid of type 2 diabetes, which is a lower risk of heart disease and cancers and strokes and infections and blindness and kidney disease and so on, like a huge range of health benefits from that. From a more sort of short-term benefit, what you get is you tend to see that people have more energy than before. They tend to feel lighter, so because when you're eating, your body tends to hold water, so you can feel a little bit bloated. So as get rid of some of that water, people feel lighter. You tend to get more energy because as your body is fasting, people think they have no energy, but what happens is that you're simply taking that energy from its stores. When you look at what happens to the human body, the body actually increases certain hormones when you are not eating, which is, one of them is growth hormone and one of them is noradrenaline. So your body is actually activating itself. It's not shutting down. So when you don't eat, when you fast, your body is not shutting down. It's actually ramping itself up, which is why, you compare a lion who just ate is just sort of lethargic. Or you can compare humans after like a huge meal like Thanksgiving. They're just a little bit lethargic, right? Compared to when you're hungry. So the hungry wolf is very activated, right? It's very focused. So you have more concentration, you have more energy, and metabolic rate tends to stay more preserved. So when you try to lose weight, a lot of the problems that people see is that the amount of energy that they're burning, the calories that they're using in a day tends to go down, which is their metabolic rate, which has nothing to do with exercise. It's the energy that you're you use generating body heat, and your heart and your lungs and your kidneys all need energy. Well, most people, when they lose weight, the amount of calories they burn goes down. But with fasting, because it's sort of ramping itself up, that is, it's increasing the sympathetic tone and increasing noradrenaline, tends to go up. Growth hormone also tends to go up. So when you do eat again, your body is going to naturally sort of repair itself. So therefore, muscle mass tends to be better preserved with that. And also the, in terms of hunger, people worry a lot about hunger, which is a legitimate concern. But over time, hunger tends to decrease during fasting because the body learns that it can feed itself through its sort of own body fat. So you just don't get hungry. So for example, people who skip breakfast routinely, well, they just don't get hungry at breakfast because they're habituated. They don't expect to eat. So therefore they don't get hungry. Well, if you're not hungry, that's a huge advantage when you're trying to lose weight, right? It's the problem is that people get too hungry and therefore they find themselves eating more. So if you can do something like fasting, which is training your body to only expect food once or twice a day, well, once you establish that habit, that's a huge advantage because you're simply, you're working with your body instead of fighting, your body, which is what a lot of these calorie restricted diets do. They constantly feed you. So therefore, like if you think about the old strategies, which is what a lot of people used to talk about, low fat meals, and eating sort of 6 to 8 times a day. Well, what does that do? If you're eating 6 times a day, what happens? Well, you take a little bit of food, you stimulate your appetite, right? Because you see the food, you're salivating, you're getting
Oh
food
yeah,
in, and then
absolutely.
you try and stop. Yeah, and then you have to stop yourself before you get full. Well, that's what an appetizer does, right? If you think about what an appetizer is, it's a small portion of food that makes you more hungry, not less hungry. So if you're taking sort of, little appetizers throughout the day, you're actually stimulating your hunger through the day, but then not feeding that hunger. Well, that's a terrible way to go, right? It's like you're making life so much more difficult for yourself. You're stimulating hunger and then deliberately not feeding that hunger, as opposed to training your body to be less hungry because you're simply not expecting it. Like it makes no sense, the sort of old strategy of eating constantly. It really was bad from a physiology standpoint, but also bad from a behavioral standpoint.
Yeah, so when you do a longer fast, there's going to be a number of considerations. We look at the whole picture. It's not just symptoms. We also look at blood work. So we do, weekly or sometimes sooner, we do regular blood work to monitor the status of the body, and couple that with symptoms, couple that with how the person's feeling, their reserves in terms of nutrients and fat reserves, and that's how we get a clinical picture to see whether or not someone should break the fast. I'm not really about, and therapeutic fasting is not really about trying to prolong the fast as long as possible. It's actually to fast as long as necessary, but as short as possible. Okay.
Hmm.
And it's to actually achieve the goals of the patient, or achieve the health goals without exhausting the body's nutrient reserves. Okay. So if we can manage that, we manage that by making sure that it's a good candidate to fast, that we're getting regular monitoring in, so daily monitoring and also regular lab work, so urinalysis, blood work, and then monitoring of symptoms. And then when it's time to break the fast, then we start to make plans to break the fast. But what we're really not trying to do is extend the fast as long as possible. That's where we get into mistakes like, oh, we want to do a 30-day fast and it's day 15 and you're nauseous and vomiting. Well, let's take an electrolyte just to get you to 30 days. Now that's a mistake. Okay. When the body's signaling that it's time to end the fast through all these measurements that I was talking about, then we start to make plans to break the fast. We don't really want to be adding in a bunch of different electrolytes or supplements or all these things just to get this fast going. That's I believe is a mistake. Okay. So we're not trying to lead the body to health. We're actually trying to follow the body towards health. Okay.
Okay.
That's key, because there's a number of processes that have been studied, and it's really exciting to read any new study that's coming out on fasting and how they may have discovered this particular biochemical pathway that's turning on. And that's really cool. But we also have to remember that there's a number of unknown variables that are going on, and there's a number of competing pathways that are going on that we really don't want to mess with until we know exactly what's going on. One of those is going to be adding in an individual electrolyte. And so my medical director, Renae Thomas, actually, we talked about this because we were trying to understand, people would ask us a lot, why can't we just put in electrolytes while we're fasting? And she told me that we kind of talked about this and realized you add in a few electrolytes in the hospital for some reason, and you do it through an IV, all of a sudden now your body might get imbalanced and need to add new ones. Okay.
Yeah, exercise is not recommended. Not the type of fasting that I supervise, that I'm experienced in. We really recommend limiting exercise as much as possible. And so you really want to be in a total state of rest or as close to that as possible. And from an immediate perspective, things like dizziness, lightheadedness, they're very common during fasting, especially that orthostatic. So when you're going from sitting to standing or lying to seated, you can feel quite lightheaded, and we don't want you to pass out or faint. And exercise is going to exacerbate that. You're also exercising with no glycogen stores, so you risk hypoglycemia or low blood sugar. Again, fainting, passing out, things we don't want to happen. And you also start to deplete your electrolytes that while you're fasting, you're not replacing. And so you're going to end up shortening the duration that you can fast for by exercising. And we have had people, unfortunately, that have exercised against our recommendation, and they typically feel really slow and fatigued. And it's not giving the benefits of exercise because your body doesn't want to exercise while you're fasting. And afterwards, most of them feel awful. They usually need to break the fast shortly after. It's just not conducive to fasting. You're supposed to be resting and healing, not going out. And while exercise is beneficial, exercise is breaking down the body, right? So that's it. You're pushing your stress, you're pushing your body, and it's the complete opposite of what we want to do while we're fasting. Fasting, we want to rest and heal, save the exercise for when you're feeling well. I mean, some people are dying to take a short, light walk. Sure, if you can tolerate it, just keep close to your house in case anything happens. But that's about the maximum that I recommend for safety, and I typically recommend avoiding physical activity. You can do a bit of stretching or bed yoga or something if you want to, if you're feeling antsy, but exercise is really not something we recommend during fasting at all. Yeah, for sure. I mean, there's the very obvious, don't fast while pregnant. That's not something that I would recommend. I don't see a huge difference between males and females per se. The differences tend to be more between individuals, right? So one of the ones we do see, men do tend to lose more weight per day, but that's common with most nutritional plans or diets. And it usually just reflects the fact that a male tends to be a larger size. They tend to have higher muscle mass and faster metabolic rate. So they do tend to lose more weight on a day-to-day basis. Women generally do have that higher body fat percentage. So you would think that they would have more stores and maybe be able to fast longer, but then they're generally smaller in size. So the percentage in terms of absolute terms of stores doesn't usually balance out there. One of the things I do see is menstrual irregularity sometimes with fasting. So it's not uncommon to see someone skip a menstrual cycle if it is due during that fasted period, but it usually doesn't have any negative long-term effects. In fact, it tends to have the opposite. We tend to see improvements in irregularities for people that are struggling. So something like PCOS, endometriosis tend to respond very well to fasting and the health promoting diet. But if you do happen to skip a period in the middle of a fast, that wouldn't be something that would be abnormal. In terms of them responding better or worse, honestly, I can't say I've really seen a difference between the sexes. I see both genders, both sexes respond extremely well to fasting. I can't say that I've seen a significant difference. I think that potentially something like autoimmune disease may be the difference, because there is a lot of female predominance in autoimmune disease, and that's where we're talking a lot of susceptibility and sensitivities to food and lifestyle behaviors, because there is that female predominance of autoimmune disease. But I think when we're looking truly at the individuals, I don't think there's a significant difference.
Fasting is a safe and effective process if it's done properly. And I would recommend people that are interested in exploring this, begin with intermittent fasting. Do that 12 to 16 hours every day. And then put all of your effort into eating a whole plant food diet that's free of added salt, oil, and sugar. And just be patient, because you'll watch and see your body heal itself. It's really quite remarkable. If you're going to do a longer term fast, do it in conjunction with a doctor that's familiar with fasting, so you can have a history exam lab and fast in a resting state with proper support. So if you're going to do a long fast, do it right so it's safe and effective. But the shorter intermittent fasting and the healthy diet, everybody can do every day. And as I said, if you're a male, you know, you're going to lose on that type of an approach an average of about 3 pounds a week, which is 150 pounds a year rate. So if your goal is weight loss, it's not going to be a problem. If you're a woman, it's going to be about 100 pounds a year rate weight loss. If you have blood pressure and diabetes, what you're going to start noticing is your blood pressure comes down, your blood sugars start coming down. The only danger is you have to work with your doctor to get off the toxic medication that they got you on appropriately, so that you don't end up having problems from being over medicated. Many of our patients, by the time they get to us, already have eliminated the need for their medication just by making the dietary change. And the reason is people are being drugged for their diets, not their condition. Right. In other words, you're being drugged for the diet that you eat that causes your high blood pressure. If you change the diet, the day you change your diet, things start improving. It's not the high blood pressure that is the complicating factor, it's the diet that causes it. You fix that, you fix the need, and then medications can be appropriately withdrawn.
I appreciate the way you said that. It's very, although it seems complex, it's very simple.
Hey, health from healthful living. Healthful living is diet, sleep, and exercise. Fasting is just a way to speed the process up. Okay? Yeah. It's a way to speed the process. Diet, sleep, and exercise. Sleep's one of our most important activities. It's often emphasized. But you need to sleep enough so you can wake spontaneously feeling refreshed. If you have to wake up in the morning and use a highly addictive nervous system drug called caffeine in order to be able to function, you're not getting enough sleep. You don't get enough sleep, you're not going to heal well. You're not going to have a high metabolic rate. You're going to have a lower metabolic rate. So it's going to be harder to lose weight. It's going to be harder to have the energy to exercise and to sustain your effective relationships. If you don't eat a healthy diet, that may be as much as 80% of the effect size you can have in terms of affecting your premature aging, debility, death, disease. And that means controlling what you put in your mouth. Because most people are addicts, it's really hard. They're addicted to the artificial stimulation and dopamine in their brain from sugar, oil, salt. That's what we talk about an SOS-free diet. SOS is the international symbol of danger, and it stands for salt, oil, and sugar. Salt, oil, and sugar are not food. They are chemicals added to food that make you stimulate your neurochemical mechanisms in your brain, make food taste good. That's what tasting good means. There's more dopamine production, but that doesn't necessarily mean it is good. It's a drug-like effect. People use cocaine and they feel good too. It doesn't mean it's healthy. They drink alcohol. They think it makes them feel, they like the way it makes them feel. Not healthy. Sugar, oil, and salt, yeah, you'll like the way it tastes, but doesn't mean it's healthy. So if we get rid of that, get back to a whole natural food diet, you can like your diet, but you're going to lose weight, reverse the disease of dietary excess, and not end up finding yourself unable to talk or move and lying in some nursing home bed for the last 20 years of your life, waiting for people to change your diaper.
So the first thing that I, partly because it's my job, but I really do recommend medical pre-screening. We want to make sure that there's no reason that this is going to be a danger to you, right? We want to go through your medical history, medication, supplements, life, what your job is, what you're planning on doing while you're fasting, all of your questions, all of your concerns, what does your lab work look like? Making sure that you're a really good candidate for fasting. So that's always the first part. Provided, you got the tick of okay, you're good to go, which most people do. I make it sound much more intense than it is. Most people are good to fast, but we just want to make sure you're not one of the few people that are not. So that we cause some harm or something like that. So once you get the kind of A-OK medically to go ahead and fast, we typically do have people do a lead-in diet. And that really, the duration of that depends on how you were eating before. Some people come in, they're living on pizza and cheeseburgers and things. We don't want that to be, we don't want any of that to be in your gut while you're fasting, because again, this is kind of not a commonly talked about thing, but most people don't have a lot of bowel movements, if any, while they're fasting. And so we don't want, your cheeseburger kind of sitting and, I don't like to use things that we don't know are technically true. You hear people talk about, rotting in the colon and things. Not really a true thing, but we do know that people that eat those kinds of low fiber, highly processed foods before the fast can often have a lot of constipation and uncomfortable bowel movements as they start to reintroduce food. So we want to make sure the first at least kind of 2 to 5 days before you fast fast. You're eating high fiber, soft, easy to digest food. So mostly fruits and vegetables is the recommendation. They can be raw or steamed, whatever feels good for you, at least 2 to 5 days beforehand, so that we know everything's kind of moved through pretty fast. Your last bowel movements doesn't mean that anything's kind of stuck in there. And that usually leads for a much more successful refeeding process after the fast. And also, people tend to have less abdominal discomfort during the fast if we know that everything's kind of cleaned through nicely before they get started. So the lead-in diet is also really important for that part of it. And the other part that we have the medical pre-screening for is that you cannot, for the vast majority, almost all medications must be discontinued before fasting. And so you do need to work with a medical professional to come off those medications. I never recommend just stopping them. I would talk to someone, it can be hard to find a professional that's on board for doing so. So make sure you speak to someone that's familiar with fasting, that's able to taper you off any medications, or be honest with you, there are certain ones that can't be tapered and maybe you are or are not a candidate. A lot of the chronic ones, we can work towards getting you off that medication, but it may not be instant. Something like a blood pressure medication may take weeks to months to be able to wean you off them. And then at that point, you'll be safe to fast. So medications and the lead-in diet are medical pre-screening, medications, lead-in diet would be kind of your top 3 things. And I think talk to people that have fasted before, look at documentaries, read some books, get yourself educated, kind of know what you're in for before you do it, so that there's no kind of unexpected surprises or things like that. And just kind of knowing what the experience is like. And I think also having that motivation, or at least the thought process of what you're hoping to achieve with your fast, and knowing that kind of going in can make it a lot easier to push through, some of the hunger in the beginning, or the tiredness or lightheadedness, or things that for most people, fasting is at least a mildly uncomfortable experience. There are some people that feel amazing, and power to them. I've seen people, I'm like, how do you feel so good? Most people feel pretty tired and fatigued, right? So it's not something you sign up to do for fun, but being able to, kind of handle those symptoms in the context of what you're hoping to be achieved, at least psychologically, can be very beneficial too.
Yeah, very carefully. So we walk people through a protocol where we safely reintroduce foods kind of slowly into the body. We don't want to be going straight to fast food and junk food. We kind of want to use fasting as a way to not go back there if we can help it, for as long as possible. And so we want to gently and slowly reintroduce fruits, vegetables, and then eventually starches, potatoes, rice, beans, these types of things into the body. But yeah, there's a generally slow phase process that we do that. And it's a little bit individual too, because some people with gut issues may not tolerate raw salads as well, or some juices as well as somebody who doesn't. So it's a kind of a case by case basis, but general principles are we do fruits, vegetables, cooked vegetables, and starches, and then beans, avocados, nuts, and seeds.